Blog Talk Radio.
This is the PFS Global Support Podcast. Our mission is to provide support, guidance, and coping strategies for men afflicted with the condition known as post-finasteride syndrome. While this is a new condition, medical research is currently working to find out more about this syndrome and hopefully a cure. The podcast, its listeners, and the victims of PFS would also like to reach out to Merck Pharmaceuticals. They are the manufacturers of finasteride, and we believe they have an ethical and moral obligation to help the men damaged by their drug. Donations can be made to the PFS Foundation, which is not affiliated with this podcast. The PFS Global Support Podcast is an independent production of men afflicted by PFS. The PFS Foundation is a 501c not-for-profit corporation, and donations made to the foundation are tax-deductible. Visit pfsfoundation.org for more information. And now, on to the show with your host, Adam Held.
Good afternoon. Welcome to the PFS Global Support Podcast. Very fortunate today to have as our guest Dr. Michael Irwig. Dr. Michael Irwig graduated from Cornell University Medical College, did his residency at the University of Virginia, and his board certifications are in endocrinology, metabolism, and internal medicine. So I'm going to bring Dr. Irwig on, and we're going to ask him some questions about PFS. If you would like to call in the show and ask Dr. Irwig a question, our number is 718-508-9136. Dr. Irwig?
Yes.
Nice to meet you.
Yes, thank you for having me.
I guess we can jump right into the questions that we have for you, and if the listeners call in, we can have some more questions. I gave a little bit of a background about you. When did you first learn of PFS?
Well, I saw my first patient who had persistent sexual side effects associated with Propecia or finasteride over 7 years ago when I was practicing in Baltimore. And the guy was in his 30s, and he reported to me that he no longer had pleasurable orgasms, which only started while he was on Propecia. And despite stopping the Propecia, this side effect persisted. And he had no other medical history or psychiatric history other than taking the Propecia. I then saw another patient and was eventually referred to the website propeciahelp.com, where I actually read hundreds of similar stories of young men who developed persistent sexual side effects associated with Propecia.
So how many PFS patients would you say over the course of your time have you seen?
Well, I've been in touch with probably over 150 men regarding symptoms associated with Propecia. So as part of my initial research studies, I ended up interviewing over 100 such men. And I did this via telephone calls and Skype and also seeing some patients here in my clinic. And for the research projects, the men were from all over the United States and actually all across the world. About half of them were international. And then I've also been in touch with, many men who have come to see me as a result. So sometimes they'll come in to ask me, should I take Propecia, or I'm on Propecia, should I stop it, or do you think any of my symptoms are related to Propecia? I get emails almost every other week from somebody related to this work.
And so regarding the men that have come to see you, what symptoms do you find that they have most in common?
Yeah, the most frequent symptoms are the sexual ones, so lower libido, erectile dysfunction, and decreased orgasms. But there's also a lot of cognitive symptoms, such as depression and fatigue, decreased memory. There's also urologic symptoms, such as a decreased sensation in the genitals and a decrease in the ejaculate volume.
And in your experience, has there been any treatment that has significantly helped these symptoms?
Unfortunately, there's no cure for this, and there's no treatment that I'm aware of that has fully resolved all of these symptoms and that's returned a man back to his normal state before he took the Propecia. I've spoken to many men who have tried different therapies, such as testosterone and HCG and Clomid and aromatase inhibitors and vitamin D and you name it, and most of the results have been quite disappointing from my conversations. Having said that, there are a handful of cases that I know where somebody did report that something did help them.
And I'm sure you're aware that there's research currently, actually, at both Harvard and Baylor universities. From your perspective as a medical expert looking at this, what would you expect the findings of these important clinical research studies to be?
Well, I think that the research is basically seeking to further characterize the men who have these persistent sexual and non-sexual side effects, to kind of characterize them in more detail and to also look at genetic markers. My theory is that Propecia has altered hormone levels and neurosteroid levels in multiple organs, such as the brain and the reproductive system, to account for a lot of these symptoms. And it's likely that some men are genetically susceptible to developing this and others are not, just because people respond differently to medications, and the vast majority of men who do take this medicine do not develop this. So clearly some people are at risk for it, whereas others are not.
And with that in mind, so many men take Propecia without side effects. So when many PFS men go to a doctor, the doctor will say, well, it's psychogenic, or you're imagining these symptoms, and there's no way that this drug that's FDA approved could ever cause permanent side effects. But you believe otherwise. Why is that?
Well, the FDA has actually approved plenty of drugs which have later turned out to have serious adverse problems seen in post-marketing studies. And a lot of medications have been taken off of the market several years after they were approved. And that's because when a drug is initially approved, it may only have been studied in a few thousand patients, and therefore the full safety profile is actually not known. So only once the medicine has been out for several years and many more people have been exposed to it do you really get the full safety profile. And I don't think that we can just dismiss this to psychogenic reasons, because there is a very strong basic science evidence that finasteride causes erectile dysfunction, depression, alcohol consumption in rats and mice. And clearly this isn't a psychogenic thing in rats and mice. These are real diseases that you can see when you, for example, look at the biopsies of these rats and mice that have taken finasteride.
So, and I know you touched on this in an earlier question. As a victim, as someone that's suffering with PFS, I know how happy I would be if at least I could have a treatment or a cure. Do you believe that that's in the future, or do you think this disease will just exist without any help?
Well, we're at the initial phases, so remember that this was only recently reported. The persistent sexual side effects was only reported 3 years ago, approximately in 2011. So this is still a new area, and medical research is a slow process because it involves planning studies very carefully, getting them approved. Often you have to obtain funding for them, enrolling subjects, analyzing data, and publishing the findings. So this is a long process, and we're just going to have to be patient, but I'm hoping that a lot more research is generated in this, and the more research and the more talent we have working on it, the greater the likelihood that a treatment will be found in the future.
That's great. Dr. Irwig, we actually have a caller. So I'm going to put the caller on so they can ask a question. And again, if you want to call in, the number for our show is 718-508-9136. Caller? Hello?
Hi, is that me?
Yes, 858. Yep.
Oh,
What's
that's
your name?
me. Oh, I didn't know what I was doing. I was just kind of calling in to listen. My name's Kelly.
Hi, Kelly.
And hi.
Dr. Irwig, can you hear Kelly?
Yes, I can.
You guys can hear me okay? Okay.
Yep.
Here, let me go in a better place. Oh, sorry. I was just calling to listen in. I've been following the Foundation's work because I lost my husband last year, who was on Propecia to suicide. I think you might be speaking to my mother-in-law about it because she's been really, in touch with you guys and following every move. But I thought I'd hop on to see if I was here, to hear any other people that might be calling in that are suffering from it, just to try to understand it or maybe help them in some way.
Yeah, well, that's an excellent point that you brought up. And, what I like that you brought up that we haven't touched upon too much yet is that a lot of the men who have the persistent sexual side effects also have depression and have a high level of suicidal ideation. And I'm aware of several suicides as a result. And this may be due to actually hormone changes and neurosteroid levels in the brain, and there may also be a role for depression secondary to the sexual dysfunction. But death and suicide really are the most serious adverse effects of the medication. And I really would hope that we get the word out about this, particularly with the awareness about counseling men who are considering taking this medicine, that this is a potential side effect, and that the warnings appropriately reflect this on the product labeling, for example.
Yeah, I agree. Yes, I completely agree.
Kelly, I'm gonna put you on mute so you can still listen to the show. I've got a few more questions for Dr. Irwig. Okay, thanks for calling, and please stay on the line.
Thank you.
All right. So Kelly, yeah, you had a good point there about the suicide. And counseling patients. So what would you tell a young patient, say a young man, in his 20s or 30s that comes in and says, Dr. Irwig, I'm losing my hair. I'm thinking I want to take Propecia. How would you counsel that man?
Well, I would basically say that this young man needs to have a good understanding of the potential benefits and the potential risks of any medication that he would be willing to put into his body. And so, he needs to be aware of the potential risks of persistent and possibly permanent sexual dysfunction and depression. And although the likelihood of the persistent side effects is low, the severity of this really needs to be taken seriously, especially for a medicine that's used for cosmetic purposes.
And so with that in mind, the comment you just said that stuck out to me is that this really needs to be taken seriously. Personally, when I took the drug in 2010, there was no warning permanent side effects, and I wouldn't have taken it if I would have known there was even a chance that this could have happened. So what do you think the fate of this drug is going to be, say 5 years from now, 10 years from now?
Right. Well, finasteride is now generic, and my guess is that it's still going to be on the market. It certainly has a legitimate use, particularly in older men who take it for enlarged prostates. But I would like to see some stronger warnings, particularly as it relates to the possible death and or suicide. And it's really important that prescribers of this medication, whether they be dermatologists, hair transplant surgeons, primary care doctors, be able to communicate this with potential patients. And it's also good that people do their own research, because sometimes people actually learn more about a particular medication than their doctor, for example, would know from reading studies.
That's great. So this woman, I know you've produced 2 papers on finasteride, one on the effects of the finasteride, and I think you also did a paper on alcohol consumption. Is that true? You've done research. Can you talk about that a little bit or not? I don't know.
Yes, I can certainly talk about any research that has been published because that's out there in the public domain, so I'm happy to comment on that. So I've actually published 4 different papers. Right now, the first one came out basically describing a case series of 71 men with persistent sexual side effects. And then the subsequent studies, one of them followed these men for an average of 14 months to see if the symptoms got better or worse. And it turned out that almost all of these men continued to have persistent sexual side effects for a mean of 14 months later. There were only 2 men out of 54 who, so to speak, their symptoms did resolve. So that was not a positive sign from that standpoint. I also looked at these men in terms of the depression and the suicide just by administering a validated instrument called the Beck Depression Inventory 2, and that's how I came up with figures with a very high prevalence of depressive symptoms in these men and also suicidal thoughts. And then in 2013, just a few months ago, was the paper that you mentioned about the decreased alcohol consumption. So I didn't really know that looking into this, but it was very interesting that during my interviews with men, a lot of them told me that I could no longer take alcohol and that it affects me in a different way. And I used to be able to drink a lot more, but now I get worse in side effects and I don't have the pleasurable sensation that alcohol used to have. And a lot of the men actually told me that they had to quit drinking alcohol entirely.
Yes, I would agree with that from just my story, my perspective. And Dr. Irwig, it looks like we have one more call. Is that okay? Do you have time for another
Sure.
call?
Yeah.
Okay. Oh, hello. Nope, they just hung up. Okay. I wanted to ask you one more question. So right now, some people might know there's the PFS Foundation, which is not affiliated with this podcast, but their goal is to help fund research to understand and eventually cure post-finasteride syndrome. So if you had, $10 million that you could, use to research PFS, how would you allocate that money? In other words, what kind of studies do you think are going to eventually lead to a treatment or a cure?
Well, I think because we're still in the infancy of this, we need to fund studies that are both at the basic science level, so looking at animal models in rats and mice for finasteride, but also doing clinical research on humans, such as genetic projects. And I would basically fund the best and the brightest that are out there. So I would fund researchers who have demonstrated a successful track record in conducting research and in publishing it. I would also fund independent researchers who have not received money from pharmaceutical companies as there's a potential conflict of interest.
And we do have another caller. I think hopefully this person will stay online. Let's see. Hello, 832 area code. What's your name?
Yeah, hi, this is Lee. Can you hear me, Adam?
Hi, Lee. Dr. Irwig, can you hear Lee?
Yes, I can.
All right, Lee, go ahead.
Great. Do I have a few minutes? Is that
Yes.
okay? Okay, first I wanted to start out by saying thank you to you, Adam, for what you're doing. It's important work, and also thank you, Dr. Irwig, for coming on today. Dr. Irwig, I don't know if you remember, we exchanged a couple of emails last fall, and this is slightly off topic, but it's very important and very similar. I took another 5-AR inhibitor, Avidar, which is kind of a sister drug to finasteride. Can you guys hear me okay?
Yes.
Yep.
Yeah. And I took it because I'm fighting prostate cancer. So I was highly, highly motivated to take this drug. When I took it, I tried to take it 3 times, and each time I had all the symptoms of post-finasteride syndrome that you've been discussing on previous blogcasts as well as this. And all the symptoms to include severe, unprecedented, undescribable depression. But what was particularly disturbing, and why I want to thank you gentlemen so much for what you're doing, was the tirade, the unbelievable tirade from my very own oncologist telling me what a tremendous, insane idiot I was for not trying to continue to take the Avadar. What a terrible, terrible experience. And I listened to, Adam, a previous interview you did with a fellow from Great Britain, how demoralizing it is to have doctors tell you you don't know what you're talking about. So upsetting. So I just wanted to share that for anyone that's out there listening, consider that any 5-AR inhibitor, maybe Dr. Irwig, you can speak to this a little bit more, you could be in the subset of men that have issues with it, and to be careful. And do you remember our email exchange at all, Dr. Irwig?
Yes, I do. Yes, and thank you for that comment. And I think that it is an important point because the dutasteride, which is very similar to finasteride, works to inhibit the same enzyme. So it's very likely that a lot of the same symptoms would occur because it affects the same hormones, the same neurosteroid levels. So if somebody's having these persistent effects with dutasteride, it very likely is following a very similar mechanism to the finasteride. And your experience just about the unawareness of your doctor, just points to our great need to really increase the awareness to the medical professional community about this in multiple specialties.
Right. Thank you. And I did also wanted to let you know, I did see Dr. Kira here in the Houston area at Baylor. We had a good talk. We're still in the process of monitoring my numbers. I'm not on any medications or hormone therapy at this time. We're still hopeful that the second dose of radiation that I had will control, kill, eradicate my prostate cancer. On the one hand, my new oncologist, who does not yell at his patients, said we could try if my PSA starts coming up, we could try Proscar. I might do better on that than I did on Avadar. But Dr. Kira advises me against it. He says I'm lucky that I got off the Avadar and returned to normal function mentally and physically, and he advises it against it. But as you can see, I'm still kind of between a rock and a hard place. Obviously, the cancer is a frightening diagnosis, and I'm only 51 years old. But that's something I'm going through, and I called in to just share my story and to thank both you gentlemen for what you're doing.
Thanks for calling me. Good luck.
Thank you.
And thank you, Lee. Dr. Irwig, thanks for coming on. If any listeners want to find out more about PFS or more about your research, is there a place that they could go to read more about what you've done?
Well, I think a lot of my research, some of the abstracts and some of the links have been published on the Post-Finasteride Syndrome Foundation's website, and I think also on the PropeciaHelp.com website. So I think there are links to current research that's been done, and I think that would be the best starting point.
Great. Well, thank you for calling. We might have another caller. Do you have time for one more caller?
Certainly.
All right, let's see. I don't know if it's Lee. Hello, 832?
This is still Lee listening.
It's still Lee. Okay. All right, Lee. All right, Dr. Irwig, thank you for your time. I appreciate it. Please keep working on our behalf. Hope we'll have a much different meeting in the future where we can thank you for being one of the first ones to sound the alarms on this disease, syndrome.
Great. Thank you so much for hanging in there. And to all of the people that are listening, please do take part in research studies if you have the opportunity, just because the only way we can advance science and our understanding of this is if people participate in the research studies.
Okay, thanks, Dr. Irwig.
All right, take care.
Take care.
All right, bye.
That will be the end of our show. As always, you can email the show at PFS Global Podcast. That's PFS Global Podcast at gmail.com. The PFS Foundation, which isn't affiliated with this website but has a lot of information, is found at www.pfsfoundation.org. As well as if you are interested in making donations, you can do so through the PFS Foundation. We will be on soon with more guests, victims of PFS, as well as more medical experts that have treated men that are suffering in this way. So until next time.
Thank you for listening to the PFS Global Support Podcast. This independent production is for PFS victims and their families. You can reach the program via email at pfsglobalpodcast@gmail.com. Donations for PFS research can be made to the PFS Foundation at their website, pfsfoundations.org. Again, thank you for listening to this week's PFS Global Support Podcast.